Well, hi, everybody. Welcome. We are talking about the GI-MAP fundamentals, and we're going to talk about a little bit more about pediatrics in this lecture today. I try to, go through what I get asked as questions a lot of the times by providers and things that, we need to understand a little bit more about and dive in about. And one of the things that I'm starting to notice more and more is that providers are doing more pediatrics, which is fabulous. The downfall is we don't have enough education and we don't have enough understanding of the pediatric microbiome for many of our providers who are a lot of the time specializing in adults. So we're going to kind of jump into learning about the pediatric fundamentals and what were some of the markers, specifically bacteria and firmicutes specifically. We're going to learn about some of the DSL education of resources, just so everyone knows where they are and what we have. We're going to be talking about shaping the pediatric microbiome, the 8 factors that impact the developing microbiome, firmicutes and bacteria's development in pediatrics, which is super important, and the impact on digestive insufficiency and things that I typically see in my practice and when I'm working with kids. Now, I specialize in pediatrics. My main focus is autism and ADHD, but I can and do work with complex cases that other people don't want to work with. So I have a very diverse knowledge in the pediatric microbiome. If you're curious about all of our education resources, we have a lot of education resources for our providers, probably one of the most comprehensive libraries that I have seen from any functional lab company. We have the GI-MAP interpretation guide. We have tons of webinars, podcasts, videos, articles, and blogs. We have white papers, methodology guides. We also have a stellar DSL Academy with GI-MAP courses, H. pylori courses. I mean, you name it, we have it. We go over it. We are constantly creating content to our providers so that they have a vast knowledge of working and understanding, especially because we're all on different journeys and different wavelengths. So we might not all have the same education background. So this is awesome for us to help out our providers and understand where all of our resources are. So in our interpretation guide, just if you're unfamiliar with some of the resources we have, everything is online too. And we have a lot of tables, which I love and I appreciate. We also just came out with a fiber table and handout, which is fabulous for our providers. So I'm a very visual person. You'll see in my presentation today, I have created some graphs and some pictures and things like that to help explain what's going on. And that's just how I learn. And I always think that it's a nice visual. So for me, I appreciate all types of tables and graphs. So when we're talking about testing consideration, there's a lot of different things that we need to think about. And one of the biggest things is thinking outside of the gut. Now, especially when I'm working with pediatrics, I am also thinking about other things and other factors that could be impacting their microbiome. It might not just be their gut that is imbalanced. There could be other types of toxins like heavy metals, mold, environmental toxins, and, even trauma that could be impacting their gut and stress. Our kids are under a lot of stress today. Things that with our testing specifically too, we don't, there's a lot of stool test companies out there that also do 3-day collection, 4-day collection, or, certain things. I like the GI-MAP specifically because it's one collection, especially for a kid who sometimes is constipated too. So we want to always try to collect on a normal day, also within 4 different areas. So sometimes I tell my families to take a plastic bag with a stool outside, kind of chop it up with a plastic knife and take from different areas and put anything in there that looks not normal. It does help. Testing represents a snapshot in time. It's not going to give us a whole diagnostic picture of that person, but it's going to give us a really good idea of what's going on in that system. And with kids specifically, kids are repetitious. So a lot of my pediatric patients, they eat the same thing all the time. So it's not like there's too many variables with them. And medication and supplements. So many of my kiddos are on all different types of supplements and medications. And that's something that we want to take into consideration. We do have some outlines of what you should ask if, they're on a PPI, if they are on certain probiotics, you can ask, and we can let you know when to stop them before collecting and when to retest. Now, with normal adults, we could say, within 30 to 60 days. With children, it could actually be around the same time or shorter. And the reason why it could be 30 to 60 days with children is because depending on their age, their gut is consistently growing and changing. So we actually, depending on their age, could retest in 30 days or 60 days. And we're actually going to see a different change in them because their gut is changing and developing during certain and critical times of their life. If there is anything that is a red flag, or you get an email or something is alarming, you definitely can ask us questions in our consultations, or you can reach out to the customer service and ask them questions through email as well, and they'll forward them to one of us on the clinical team so that we can help you. So there are some things sometimes that might be alarming and you're not sure what to do, and that's why we have these consultations with providers, but we also have the ability to, help you and explain to you what some of these, unwanted pathogens could be. So just some testing considerations when it coming to pediatrics, because I do see some of these things quite often. So we're going to dive in, and one of the first things that we're going to talk about is shaping the microbiome. Now, when we're shaping the microbiome, there's a lot of things to consider because research is consistently growing every single day. And what we used to think that babies were born with a sterile environment, and that's not so much the case anymore. We actually have been coming into new research that maybe there is some colonization in the microbiome that wasn't there before, or what we didn't think, because we always just thought babies were born with no microbiome. So during labor and after birth, the mother's microbiome plays a really crucial role in developing the microbiota. We actually donate hundreds of genes in bacteria into the baby's gut, which influences their development and infant's immune system and cognition over time. The human microbiome is considered mature by the ages of 2 and 3. And this means that between the ages of 2 and 3 years old, the microbiome should start maturing to look like an adult microbiome. And so that when you are looking at different types of stool testing, depending on your patient, that actually is going to mean that the interpretation of your test results could vary greatly. So between 2 and 3, it should start looking like an adult microbiome, not always guaranteed, but they should start looking like an adult microbiome. And there are many things that influence the pediatric gut, which is diet, environmental factors, interactions with caregivers. These period of time, this critical period of the development of the microbiome actually coincides with the development of neurons in the brain. So that's where that gut-brain connection comes into play. So we want to lay that foundation for the future. And that's really important for us to make sure we understand what we're, looking at and how we can help our patients to thrive. There are 8 top factors that actually impact the microbiome, which is a lot of factors. Now, you have a developing microbiome, and it starts as early as either a vaginal birth or C-section. Our rate of C-section is actually increasing every year. We're up to about 32% of our mothers who are actually having cesarean C-sections versus having vaginal births, and that greatly impacts the microbiome from day one of life. Breastfeeding versus formula feeding, the breastfeeding rate is increasing in the United States, which is a great thing to see, but only 1 in 4 infants are exclusively breastfed until the age of 6 months. So we are still relatively low behind the rest of the world. Now, we understand the concept that breast is best, but formula can be helpful in certain situations. But the downfall is we need to also look at the microbiome if a child is on formula, because they would be missing some of those key factors in their development of the phyla. Antibiotic use and exposure, 70% of kids have at least 1 antibiotic use before the age of 2. Most of the antibiotics that we are seeing and kids are receiving is due to ear infections, which most of the time they don't need. And so if you have a child before the age of 2, before that gut is maturing, take antibiotics, it could really wipe out all their beneficial microbial species, which really can damage the gut-brain connection as well. Dietary introduction and composition. So this is basically meaning if we're introducing food earlier on, this is still a most common practice, which I'm not sure why. The standard of when we should introduce feedings for children is 6 months. And that is specifically because their microbiome can't tolerate anything prior to that time. Consuming foods too soon actually damages the natural progression of the microbiome. And it has been linked to things like allergies, obesity, immune dysfunction later in life. So, asking these questions ahead of time, I ask all my families these questions, is really important to understand what is going on in that gut. Environmental factors, my pediatrician, when I was a kid, my parents loved to tell me, my pediatrician used to tell my parents, let her eat dirt. That was like a common thing back then. Play in dirt, eat dirt, live it in the soil. And that's actually how you get a really good diversity. So getting kids outside more, grounding more is really super important for their microbiome. Genetic factors, things like, if they have specific enzymes for breaking down specific sugars or not, that could really impact how their digestion process works, as well as gastrointestinal infections. Unfortunately, we are seeing a lot more infections going on nowadays. Flu, COVID, GI issues, GI bugs, things like that can actually still wipe out the microbiome for a pediatric patient pretty easily too. So those are things to ask as well if a patient has ever been sick. And the last thing is polyphenols, probiotics, prebiotics, and postbiotics for the diet. So especially if they are starting to eat and they're consuming more foods, are they eating bright colored fruits and vegetables? Are they eating across the rainbow? Are they getting good fibers? Are they getting good post-metabolic byproducts of fibers, those fermented dietary fibers to inoculate the microbiome? And all those things play a significant role in creating the microbiome from an infant standpoint. So with a newborn baby, this is, like I said, I love my graphs and I love pictures. So I created this to kind of make it a little bit easier for people to understand kind of how a baby's phyla looks early on. So a pediatric microbiome phyla actually isn't something that we would normally think looks like something like this. If this was an adult patient, and this was their phyla, we might get nervous and say, oh my gosh, they have a ton of inflammation. They have a ton of overgrowth. And that is actually normal for a baby phyla. So one of the main things that I want you to focus on is that proteobacteria in the bottom right corner is 30%. Now, proteobacteria is actually readily available during birth, especially, going through the vaginal canal. And it actually plays a huge role in early development of the immune system by actually stimulating the immune system. So this is actually important. I know we might think, oh my gosh, this proteobacteria is so high. Proteobacteria is so inflammatory. LPS, we need to get rid of it. But for a pediatric gut, up until about 1 year old, this could be kind of normal for them until they start breastfeeding and feeding with food. This could be completely normal and completely safe for a baby. Now, when they get to about 3 years old, so remember we said that the maturation of a pediatric gut is between 2 and 3, you can see everything diversely changes. That proteobacteria, which is now in the upper left corner, is only 5%. So it drops significantly from almost 35% to 5%. So now we start looking at the actual gut as it's a mature adult microbiome. So this is super helpful in order to understand the role of how the phyla will change within the first 2 to 3 years of life. So when you are looking at a microbiome, don't get nervous if you start seeing a lot more inflammatory microbes in the gut of a newborn. That is totally normal. It actually really helps to make their immune system. So this is, I think, a really helpful graph to show how the microbiome is shaped and what could actually go in the opposite direction when things aren't the way that we expect. Now, I understand C-sections sometimes happen. They're a necessity. Formula sometimes is a necessity and what needs help. But when we're looking at this from a microbial standpoint, inoculation of the microbiome, we can see here that we're going from the newborn baby, the environment of vaginal skin, the breast milk. We see all the beneficial things that it's going to give our child. If you look below, we can see all the areas and the specific species that could be elevated because of something else. So with C-sections, we could see that we have some elevated staphylococcus and some other bacteriums, especially with formula milk, Bacteroides, Clostridium difficile. So we could have a lot of overgrowth in areas that are unwanted just because of unfortunate circumstances that are interventions here. But we can do a lot for this. We can push the gut into the right direction. I usually say sometimes with pediatrics, the microbiome veers off the road and into a ditch. And sometimes we just need that tow truck to bring it back online and back on the road and get it going, and with some supplements or some interventions, because the goal is that they can take over and do all the beneficial stuff later on in life. So I really enjoy this little graph. I think it's super helpful. So I hope it makes it a little bit clear too what could go wrong too. So you could keep this also and note that if you do see things in the GI-MAP, you can say, okay, then I think this could be related to this. And now we're going to have something to do about it. So as we're creating that phyla, this is where I get a lot of questions when we're talking about the bacterial phyla, especially with Bacteroides and Firmicutes. Now, the Bacteroides and Firmicutes is a main staple in our microbiome. It's almost like 90% of our gut. So yeah, it holds a lot of weight, and especially in pediatrics, it could tell us a lot of information and a lot of things things. And for me, when I'm interpreting this to parents, it kind of rings a bell when I start explaining things. They go, oh, okay, that makes sense. Yes, this person does this person eats this. It does start to make a lot of sense. So we're going to kind of dive into explaining a little bit more about the Bacterias and Firmicutes here. So Bacterias is the most abundant gram-negative in the gut, and it plays a specific role in maintaining digestion and metabolic health, primarily in the distal colon. It thrives in a neutral pH environment and struggles in acidic conditions, which is most of our microbiome and a lot of our microbial species. They do better in a neutral environment. So once that pH is off, things kind of go a little bit south. So it possesses one of the largest rhetoric of carbohydrate active enzymes among gut bacteria. It breaks down a lot of complex polysaccharides like starches, cellulose, hemicellulose, pectins, and polyphenols. It metabolizes through carbohydrates into short chain fatty acids. And these are super important to the microbiome, especially to the brain in pediatrics too. So we're going to talk a little bit about that too. Things like acetate and propionate. It metabolizes these carbohydrates to help actually decrease inflammation in the body, but also produces energy. So what do babies usually have high amounts of? Energy. So that's super important for them, especially as their brain is developing. Because of their high dominance of occupancy rate, if they are not high in the gut, it does allow for that overgrowth. And that's what we're trying to kind of prevent. We don't want things to overgrow. We want Bacteria to be a bit high when we're looking at the more developed pediatric gut. Proteolytic metabolism, when it's breaking down proteins, Bacteria can produce toxin byproducts. And this can actually contribute to inflammation if it's not balanced and carbohydrate fermentation is not available. So there is always a fine line and a fine balance when we're trying to make sure the child is eating a well-balanced diet and eating across the rainbow and eating enough of those short chain fatty acids or resistant starches too. And things like Prevotella can act as opportunistic and conditions, including causing dysbiosis and inflammation. So we want to be careful with that as well. And just monitoring those levels in the Phyla. So the Firmicutes are gram-positive. They are acid-tolerant bacteria, more formally in the proximal colon. The key role in the carbohydrate fermentation and energy production. So they are super important when it comes to carbohydrate fermentation. They primarily feed in the digestion carbohydrate, especially when dietary intake is very high and enzymatic activity is low and the gut transit is rapid. So we're wanting to make sure that specific carbohydrates are consumed during this time. We do try to encourage families as much as possible to avoid processed foods and make sure that they're consuming more whole grain or more whole digestible carbohydrates so that those fibers actually work on producing short chain fatty acids. And remember, I said short chain fatty acids are super important for brain function because they actually help create and move with mitochondrial function. So if we are lacking in this particular area, we're going to be lacking particular energy for the brain as well. So unlike Bacteroides though, Firmicutes have fewer glycan degrading enzymes, which makes it more reliant on simpler or pre-processed carbohydrates. So when we're looking at making sure that the gut is balanced, we're making sure that the Firmicutes and Bacteroides are aligned with our nutrition and what we're providing for our patients. So when I do an intake on all my patients, I will do a 3-day calorie count. And it's super important to do this. Even if they are little, if they are 7, 8, 9 months old, I will still ask for a 3-day calorie count because what I'm trying to look at and assess is, are we getting enough fiber? And typically we are still lacking on that aspect. We are still kind of promoting and pushing, fruits and vegetables, which can be great too, but we want to make sure we have a diversity of fiber and we're focusing on specific types of fiber too. Many of our patients also come in with constipation issues, and sometimes this could be related to either too much fiber or not enough of specific types of fiber. Also, with the production of short-chain fatty acids, specifically Faecalibacterium prunitzi and Roseburia, which are super important to creating those butyrate producers, that can actually lead to constipation as well if they are not balanced out. Now, one of the most interesting things, and I see this quite often in my practice, especially because obesity is becoming more prevalent, is with firmicutes, they consume off highly efficient calories. So if there are more calories from food coming into the gut, they're going to take those calories, and calories are calories. So if you have a patient that has overweight or a pediatric patient that is overweight, sometimes if firmicutes are just highly efficient at extracting those calories, and we might see that, on overdrive and high in the gut, it could definitely be because of the firmicutes and the levels are extremely high. Now, I get asked this question a lot, and one of the things is this firmicutes and Bacteroides ratio. So the firmicutes and Bacteroides ratio that we have on our test confuses a lot of people. So I want to clarify a couple things. On the bottom right-hand corner, you'll see firmicutes and Bacteroides. Firmicutes is above and Bacteroides is below. So think of this as like a division. Okay, so you're dividing the Bacteroides into firmicutes. And this is kind of how you get your ratio. This is really the only time in a ratio that it will be high. So you'll see on the top, Bacteroides is very low and firmicutes is very high. So if you were dividing Bacteroides into firmicutes, the number would be 2.45, which is high. This is really the only time you will see this elevated. If the levels were opposite, it would still be low. So don't take this as face value. Sometimes it has been used in research to kind of show the link between the metabolism and obesity and inflammation. So we could definitely use that. And typically, anytime I do see this elevated, it is because there is overgrowth. There is a lot of inflammation. We might have somebody who is overweight or they're having issues with their metabolic system. So again, this is something that will only kind of happen or be elevated in this case scenario, but it doesn't necessarily mean that when it's the opposite, that it's not a problem. It's still a problem, but it's just the only time that this is going to ever trigger as a positive. And just for some research, which is really interesting when, I look in pediatrics, the children obesity and firmicutes and Bacteroides ratio in the gut microbiota, they have been able to link the Bacteroides and firmicutes ratio, but also the elevation and decrease of these particular microbial species with obesity in children. So this is something that is out there. It has been used in research. It is something that does give us some really great insight of what could be going on, especially in pediatrics. And it's just fun what you can find when you do some digging. So let's talk about elevation and what would cause insufficiency and what would cause elevation in Bacteroides and firmicute levels. So as we talked about, the Bacteroides is a microbial species. And you can see down here, if this one was low, if this was a patient of yours, what could be some of the main causes that are causing the overgrowth or undergrowth of certain microbial species? So overeating. So especially in pediatrics, if we are eating a lot of refined carbohydrates, if we are not getting enough fiber, this could definitely cause a low level of Bacteroides. So again, that calorie intake, looking at the microbiome, trying to figure out what's going on in diet-wise. That's super helpful for both Bacteroides and firmicutes. Oxygen. So Bacteroides is anaerobic, so without oxygen. So if we have elevated oxygen levels in the gut, which a lot of times is due to inflammation, we could see a lack of growth of our Bacteroides as well. Most of my kiddos are going to have inflammation and they're going to have issues. Low butyrate producer. So if we're not producing enough butyrate or those short chain fatty acids, it makes it very unfavorable environment for our Bacteroides to grow as well. So again, diet is super important. So blood in the stool does happen a lot in pediatrics, especially if they are having issues with, maybe dairy allergies or dairy sensitivities or food sensitivities. We might see that. So if that is the case, that actually will signal more inflammation and tissue damage, and the oxygen levels are making it more uninhabitable for it to grow as well. The leaky gut, aspect, the loss of barrier function allows oxygen to come in, it allows other toxins to come in, and that increases oxygen as well. That altered pH, remember, it thrives in a neutral pH. So if it has high or low pH, it could definitely play a big role as well. The Western diet, high fat, high carbohydrate, low fiber, makes it uninhabitable. Poor mucin health, again, degrades the mucin layer, deprives the Bacteroides from growing. as well as pathogen overgrowth, crowding out the ability for Bacteroides to actually grow and have a room for it to actually thrive. Now, firmicutes, very similar too. Low carbohydrate diet. Remember, it thrives in carbohydrates. So it really wants those fermentable carbs and fiber. Cross feeders. So if cross feeder is metabolizing byproducts or produced by other microbes, that's not going to work. Increase oxygen, same concept as Bacteroides. So we're having too much oxygen, low butyrate, that blood, that loss of barrier and mucin function. Same exact thing. It creates an inhabitable ability for them to produce, for them to maintain, for them to thrive, for them to actually have the ability to present itself, to not get crowded out and be able to thrive in that environment. So that's if it's undergrown. So if it's overgrown, here is a great chart. You can actually take a screenshot or you could print this chart out because this is super helpful if you're looking at overgrowth. So overgrowth, we're looking at, so for instance, firmicutes. If your firmicutes are super elevated and super high, your Bacteroides is maybe middle ground or low, what could be the problem? Well, we could have decreased pancreatic output, low digestive support. We could have, again, that Western diet, high fat, high starch. I see this all the time in my pediatric patients, and I'll show you shortly. And infections that are on the brush border. So any type of pathogenic overgrowth or any type of irritant can actually increase firmicute production. Similar with Bacteroides, I actually see this a lot in constipation as well. So if you have constipation, you could have elevated Bacteroides as well. A high protein diet, which also sometimes can lead to constipation, not always, but sometimes. Or the keto diet, high fat, low carbohydrate diet can also increase our Bacteroid overgrowth. Now, one thing that they both have in common, and something that we're going to speak a little bit more on, is this Phyla, which is the hyperchlorhydria. So hyperchlorhydria is low stomach acid. So when you have low stomach acids, it actually alters the pH. Remember, you're looking from the upper GI all the way down. So in the gut, if you have an altered pH and an altered gut from the start, it will alter the pH for the rest of the system. So you will see one of the main issues is, okay, if we do have hyperchlorhydria, if we do have this low stomach acid production, what could be causing this low stomach acid production? Well, for kids, it could be a number of things. It could be H. pylori, which is something that I'm always on the lookout because roughly about 50 to 60% of children could have H. pylori, but only 20 to 30% are going to have symptoms. So a lot of the times they don't have symptoms. They present, without anything where parents would not even realize that they have it, but it actually causes a lot of dysregulation in the microbiome from the start to the finish, including iron deficiency, which is another thing that I typically see a lot in my kiddos because H. pylori thrives with iron. PPIs, unfortunately, PPIs are used and I think overly used in the pediatric population, especially early on infancy. I do ask this of my patients too, because a lot of the times they will say, I was breastfeeding or, and my baby was spitting up consistently. So, they put them on the acid reflux medication. It went away for 2 to 3 months and then we stopped. The baby's growing and changing, but elevated PPI also can increase SIBO production in children. So it's something that we definitely want to keep an eye out. Ask your patients if they've ever taken PPIs. So when we also have H. pylori, we'll get urease production, which also decreases our stomach acids further. They're not digesting their food. They're not absorbing their nutrients. And then specifically, they're also not digesting and getting that nutrients for the brain, which can impact that gut-brain connection. Stress is another one. I know that I touched on this a little bit earlier, but a lot of our kiddos are under a lot of stress. And I know we don't think about it, but kids have a lot of demands on them and their environment can be stressful. Their school day can be stressful. Like my son is on the spectrum and he has a full day, he has therapies. And then sometimes, we are going to judo or we're going to religion or he has his reading tutor. And, you can tell your kids are getting burnt out. So they are under stress. They just handle it very differently because they don't know any better. So it's something to reevaluate also with your children and patients that you're working is if they are under a lot of stress. And then also just in case you are working with adults over the age of 65, automatically kind of puts you at a risk for hyperchlorhydria as well. On the GI-MAP, one of the best things to look at and what I look at, and that's probably one of the second things I look at. First, I look at H. pylori, and then I shoot right down to the intestinal health marker, and I want to see where the steatocrit and the elastase is. So steatocrit measures the amount of fat or feces, fat in our stool. And a lot of times, it's hard to tell with pediatrics because a lot of them are in diapers. So their poops won't float like an adult would sometimes. So when we're trying to judge, I'll just say, take the stool out of the diaper, put it in the toilet and see if it floats. If it floats, then we know we have pretty high fat in the stool as well too. And elastase is created by the pancreas, and that's going to help us digest our fats, protein, carbohydrates, and released in the small intestine. So when I see a level, roughly the digestive tract for a child will be developed around 12 to 14 weeks in utero. So as your child is developing in utero, between about 12 to 14 weeks, the digestive tract should develop in the microbiome, which is kind of crazy because it's very early on in a pregnancy. It does mature by the time the baby is ready to be born. After a few weeks after birth, it should be normal. So the elastase levels should shoot up. We should really see in a robust digestive support enzyme elastase of over 750 within a few weeks of life. So it's not anything that does take time to like months or years to develop. So it should be a short amount of time after birth. So if I see anything below 200, that is digestive insufficiency. We have digestive insufficiency and the child needs to be treated. If I see between 200 and 500, that's around suboptimal levels, and we still should be treating because obviously something is not working and that person is still having hyperchlorhydric issues. What are the risk factors with hyperchlorhydria? Well, what could cause it besides the H. pylori and besides, insufficiency with the microbiome? High sugar diets, poor protein diet, low zinc levels, stress, eating too fast, which again, a lot of our kiddos do a lot of these things, PPIs, antacids, and toxins. Mold is one of our biggest culprits of damaging the digestive tract. So if you have a child that you've been working on for some time and you're trying to figure out like, why is this not working? Why are we not seeing the results that we want? The toxic load of mycotoxins might be part of this. So when I work with kids with autism, this is pretty prevalent in my population. They are eating high sugar or high carbohydrates. They're not eating enough protein. They have low zinc. Over 30% of kids with autism have low zinc deficiency. They're under a lot of stress. They eat super fast. I mean, some of them don't even chew their foods or masticate their foods well. And a lot of them are filled with toxic fluid. Now, symptoms of hyperchlorhydria can vary. Now, I put a lot of the normal ones, the feeling full, even or feeling like you want to eat even when you're not hungry, feeling too full, indigestion, all of that jazz. But if you go down to the bottom, I have a couple other ones, which is belching and burping consistently, clearing of the throat, and vocal stimming. Again, I put these in here just in case you do have a child with autism or ADHD and you're asking symptomology of things. These could be triggers and clues of, could it be hyperchlorhydria? Could it be H. pylori too? Because they're very similar in symptomology. So we would definitely want to know if any of these symptoms could be related to some of the levels that are in the gut. So a couple things, what I have always learned and seen in pediatric microbiome is there are times where the elastase levels could totally be normal. And the elastase levels can be influenced by how much protein we're eating a lot of times. So if you do have a kiddo that when they collected the stool had a high amount of protein intake, their elastase might be normal for that particular stool. But when I'm looking at their phyla, if I see that the Bacteroides and Firmicutes is super high, off the charts, I might start to think maybe they do have some hypochlorhydria or low stomach acids. It just didn't show up in this particular stool test because it can fluctuate a little bit depending. I do have some kiddos that will only eat chicken nuggets, or I have kiddos that love meatballs or, certain types of meats. And depending on that stool, it can vary a little bit. So definitely kind of cross-check yourself and look at the elastase because I do see this pretty prevalent. I would say 70% of my children, pediatric population, do have low levels of elastase, but the Bacteroides and Firmicutes could be really elevated and high. And this is also, if you look, that Firmicute ratio is normal too. So I definitely want to always take a look at that as well and kind of conclude my own conclusion on that one. Now, this was something that I wanted to also explain because, again, when you're working in pediatrics, again, the levels and what we're seeing kind of sometimes coincide with exactly what's going on with that person. So this is actually a pediatric patient of mine that only ate carbs, and all of the carbs that they ate are beige foods. So it's your pizza French fries, chicken nuggets, crackers, cheese. And so sometimes I will see it this drastic where the firmicutes are going to be super elevated because we have too many carbohydrates and taking off, and the bacteria is just left behind in the dark. So a lot of times you can infer dietary needs, especially in pediatric space, a lot of these results too. So how can we increase elastase levels? We need to get to the root cause. Okay. We need to understand what's going on, why this is happening. Is it because of H. pylori? Is it because of diet? Honestly, most of the times it is diet. It's unfortunate, but besides parsley on pizza, most of my pediatric patients don't have any type of herbals or anything like that. It wasn't too long ago that we used to eat dandelions. So, we've come very far from what our diet used to be and supportive to the microbiome and to the digestive support. Mindful eating and hygiene. Again, this is really tough. A lot of my kiddos do not chew their food really well. They literally just inhale. They don't take their time to chew, slow down, really get that digestive production going. I try to teach my families, if this is the case, to take a plate of food and only portion out a small amount of time on the plate so that person has time to rest, digest, and, before moving on to just plate their whole entire meal, plate small amounts and let them eat, and then take a break, take some water, and then eat some more. Digestive herbs or bitters, which I know is kind of hard with kiddos, but digestive enzymes, especially proteolytic enzymes, which has bromelain and papaya enzymes in it, are awesome because bromelain and papaya really help with inflammation. They actually help with parasites, candida, things like that. So if you're able to get a proteolytic enzyme that has all of that together, it's really, really helpful for a lot of our kiddos. And I call it killing two birds with one supplement. So one supplement can do multiple different things instead of just relying on several different ones. And like I said, the plant and pancreatic enzymes that we were just talking about. Digestive herbs are sometimes hard, but I do teach my patients, even just trying to do some dandelion milk or milk thistle tea mixed with some lemonade actually goes a long way. So you don't have to give bitters or straight bitters. You could do dandelion root, milk thistle kind of thing, and that works really well.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.